Good morning, Mrs. Cash. And hi, Wesley. And yeah, I like your new haircut. So, how's he doing today?
Wesley's been great now since he's been out of school for summer vacation. He hasn't had any colds, wheezing, or coughing, but I've been home with him, and he hasn't been exposed to kids at daycare this summer. He's been fine, except for some sneezing and a runny nose, mainly when he visits his grandmother's house with her 5 cats. The nasal steroid spray that we've been using daily has really made a difference. But a few months ago, he did develop some congestion and an ear infection when I had stopped giving him the nasal spray. So we did start that back up again.
It's great to hear he hasn't had any breathing problems. Aside from the nasal problems, does he ever wheeze or cough when he's around the cats?
No, not at all. It seems that the coughing and the shortness of breath is only a problem when he has a cold. But I do have a question for you. When will Wesley outgrow his asthma, if that's even what he really has? I never really hear him wheeze.
You bring up a couple of very important questions. One, does a child have to wheeze to have asthma? And two, will Wesley outgrow his asthma? In young children, we consider a cough to be the equivalent of a wheeze. More than likely, if he continues with the episodes of persistent coughing, he will eventually develop some wheezing. And just as you've seen with Wesley, viral upper respiratory infections are the number one trigger for asthma attacks in kids this age. The short answer to your question as to whether Wesley will outgrow his asthma is we don't know. Some young children who have coughing and or wheezing with upper respiratory infections will see those symptoms go away by age 6. In essence, they didn't really have asthma in the first place, just temporary airway obstruction due to the virus. Of course, we have no way of knowing for sure back when he started to have persistent coughing episodes during viral infections at age 2 or 3, whether that was really asthma or not. Fortunately, it's not important to know whether it was asthma or just an effect of the virus, because the treatment for those symptoms is the same regardless of those causes: inhaled steroids and inhaled bronchodilators. If, as he gets older, asthma episodes are triggered by allergens and irritants such as dust, cats, pollen, or weather changes, for example, it then becomes likely that this will be a lifelong problem. What makes the diagnosis more difficult is that the asthma may not be active every day, every month, or even every year. It might actually go into remission, often during puberty, but resurface later in life. However, the majority of children with asthma have mild, intermittent asthma, and these children may only need to be treated on an as-needed basis. So we see an entire spectrum of symptoms. Some kids have asthma only with viral infections, and some with significant allergen exposures. Others have more severe symptoms that keep coming back every day.
So is there any way to tell which of these categories Wesley is most likely to fall into?
If I recall correctly, Wesley's father has nasal allergies, but there are no allergies or asthma on your side of the family, correct?
Yes, that's correct.
So we know that Wesley has nose and eye allergies, but he has never had skin allergies such as eczema or food allergies. What we've found over time is that the more connections that one has with a family history of allergies and asthma, and the more allergic problems that the child has, the more likely it is that the asthma will be persistent and that Wesley will not outgrow his allergies or asthma. We also factor in the severity and persistence of allergy symptoms in the early years.
So what do you think?
At this point, it's looking quite good that Wesley will outgrow his asthma, as he is now 4 years old, having less severe coughing episodes with each viral infection, and there is no sign of allergic asthma. But it is important to note that since he has had coughing with viral infections at an early age, together with a family history of allergies on Dad's side, he may be more likely to develop asthma later in life.
But I don't want to give him so much medicine. Shouldn't I be concerned about all those steroids?
Absolutely not, for 2 reasons. Most importantly, good asthma care involves using the least amount of inhaled steroids necessary to control inflammation and maximize lung function. Not only do we make sure we keep the dose to a minimum and not overtreat, but some children don't need inhaled steroids all the time. Kids with severe symptoms associated with viral infections might take steroids only during the cold and flu season. Others might need steroids only during their major allergy seasons, such as the spring or fall. Secondly, all the sources you read on the internet that talk about the side effects of steroids leave out the most important point. That is, the adverse effects of not treating the inflammation in terms of increased symptoms and not allowing the lungs to grow and develop normally because of that inflammation are far worse than any side effects of taking the medication.
Okay, that makes me feel better about it. But isn't there anything else I can do to help him other than giving him steroids?
Yes, another treatment option for the allergies that causes nose and eye symptoms, allergen immunotherapy or allergy shots, will reduce by 50% his risk of developing asthma in the future. I would like for you and Wesley's father to come in together at his next visit so that we can discuss the pros and cons of allergy immunotherapy for Wesley. For now, let's take a look at him.